Hello and welcome to Health Live at Seniors Today. February every year is observed as the Cancer Awareness Month, and we thought it appropriate to have one of the senior most doctors in this country to talk about cancer awareness, to talk about two very uh, significant ailments that exist in this country in the field of cancer. So we've invited Dr. Hemant Tongaonkar to speak about management of prostate and gynecological cancers in seniors. A little about Dr. Tongaonkar. He is Director Urologic and Gynecologic Oncosurgery and Head Surgical Oncology at the Nanavati Max Hospital in Mumbai. He has nearly 4 decades of experience. He was Head Department of Surgical Oncology and Consultant Urologic and Gynecological Oncologist at the PD Hinduja Hospital from Jan 2012 to September 21. He was professor. He was professor and head of Department of Surgical Oncology and the Department of Urological and Gynecological Oncology at the Tata Memorial Hospital from 2002 to 2012. And he was also a consultant at the Tata Memorial Hospital from 1992 to 2012. Dr. Tongaonkar has done his MBBS and MS in General Surgery from the University of Mumbai. He is a fellow of the International School College of Surgeons and fellow of Association of Surgeons of India. He received the Urology Gold Medal of the Urological Society of India West Zone for outstanding contribution to the field of urology in India in 2015, and the Dr. P.V. Rao Gold Medal of Urological Society of India for outstanding contribution to the specialty of urological oncology in India 2016. We are delighted to have Dr. Hemant Tongaonkar here. Welcome to Health Live at Seniors Today.
Thank you very much. It's really a pleasure to be here to interact with people of my age. So we are all senior citizens, and it's very important for us to interact and get to know about different aspects of life and different aspects of health. So
Yeah,
should we?
last time the Dr. Tongaonkar has been here in the past as well.
Yeah.
Last time you had said something which is still ringing in my ears, that 80% of people above the age of 80 do suffer
Yes.
uh, have prostate issues. Does
Correct.
is that still hold true?
Yeah, that still holds true. Actually, it's becoming more and more obvious now. Now that people have been living longer, and we see a lot of people who are 80 plus. So I do see a lot of patients who are 80 plus who are coming to me with prostate cancer. So of course, the data is from the Western world, but it's holding true now here also.
All right. So, without any further ado, Doctor, I would
Yeah,
invite you to make your presentation. As
sure.
Doctor is getting his presentation ready, remember that this is being recorded on
Yeah,
January 31st, 2025, 2026. And
yeah.
so, if you're watching this 2 years later, do note that there may be some updates in medical technology, etc., that you may want to update yourself with. This is being recorded and it will be up on our website on Monday evening. So you don't have to take notes. You can just listen in and put in your questions after Doctor's presentation is over. Over to you, Doctor.
Thank you. Yeah. Hello, friends. Today I'm going to give you a short presentation about prostate cancer, which is the commonest cancer that we see in our age group, the senior citizens in males, and also a little bit about the gynecological cancers that are prevalent in this age group. Now, what is prostate? Prostate is a gland which is situated outside the bladder, just outside the bladder. That is the bag which holds the urine and the outflow tract. So it's like a guard there. Okay. And it is present in all males, and with age, the size and the volume of that increases. So you can have this enlargement because of cancer or even non-cancerous causes. So what causes prostate cancer? It's very important to know that age is the single most important risk factor for prostate cancer. And as I mentioned earlier, at 80 years of age, 80% of men will have prostate cancer. And most prostate cancers are diagnosed in the 60 plus age group, unless the patient has some family history of prostate cancer, where it can be seen in the younger age group also. So just as for breast cancer, we also get patients who have a family history of prostate cancer or breast cancer. The genetic mutations for both these cancers are the same. And if a man's father or uncle or grandfather had prostate cancer, then the risk that he will develop prostate cancer is about 3 times higher. Okay? Again, it is more common in people who are obese, who do not do any physical exercise. And the other contributing factors with being red meat, foods containing saturated fatty acids, like a lot of fast foods, smoking, and alcohol consumption. Now, what are the symptoms that one should be aware of? You can see the diagram there. You can see that when the prostate enlarges, the outflow tract gets compressed. And that's why most of the symptoms are because of obstruction to the urinary flow. Now, it is more common in non-cancerous causes because non-cancerous enlargement usually occurs towards the center, while in cancer, the enlargement occurs more towards the periphery, to outside. So, it is more common with non-cancerous causes. However, whether it is cancer or no cancer, the symptoms remain the same. Usually, frequency of urination, especially at night, somebody will tell me I have to get up 4 times, 5 times at night, which never happened 2 years ago. Well, weak or interrupted urinary stream, pain or burning while passing urine, difficulty in starting or stopping urination with dribbling, then this is very important, sense of incomplete evacuation of urine. After passing urine, the man will tell, no, I still feel that there is some urine inside. After 10 minutes, he'll go and evacuate again. Blood in the urine or blood in the semen, extremely important. This could be a very early sign of prostate cancer. It should never be ignored. So if there is suddenly erectile dysfunction, again, it could point towards prostate cancer. And when prostate cancer has spread, say the commonest site of spread is the bones. That's why you can get bone pains, fractures, or even otherwise, they can have loss of weight, loss of appetite, swelling of the feet, etc. So what one needs to remember here is urinary symptoms don't necessarily mean that you have cancer. There can be benign causes that can cause similar symptoms, but just because of this, do not ignore them. And no matter what's most likely to cause these symptoms, you should get them checked by a doctor, preferably a urologist. So what will the doctors do when you go to them with these symptoms? They do a blood test called PSA, also known as PSA, prostate specific antigen. It's a blood test, and when the level is raised, then it could indicate a presence of cancer. Must remember that PSA can be raised in non-cancerous causes also, but when it is raised very high, then of course it is more likely to be because of cancer. We also do a rectal examination because through the rectum, we can easily feel at least one part of the prostate. And if there is any nodule or any mass there, it will easily.
I think we've lost Doctor. Doctor, we can't hear you.
Is parametric MRI.
Sorry, Doctor. We missed what you said for the last 2 minutes. Sorry, I think Doctor has a bad connection. These things happen with technology. Doctor, you're online now, but we can't see your video. We can't hear you either. Doctor, can you log out and connect again? Yeah.
Can you hear me now?
Yes, doctor, we can hear you now. Thank you.
Yeah. So I'll go one slide back.
Yeah.
Yes, when you go to the doctor, what will the doctor do?
We can't see the slide, doctor. We can't see the slide.
Okay. Wait for a minute. Now can you see?
No, we can't see it. We can't see it.
Some problem.
Yeah, I think. Yeah. It's coming now.
Okay.
Yes. Yeah.
Sorry. Yeah. So when you go to the doctor with these symptoms, what will the doctor do? He'll order a blood test called PSA, prostate specific antigen, and check the level. If the level is high, it could indicate presence of cancer. But PSA does not mean cancer. PSA is prostate specific. It can also be raised in non-cancerous conditions. But it's important to know that if the levels are very high, then they are more likely because of cancer and not because of benign causes. The doctor will also do rectal examination, because through the rectum, one can easily feel at least one surface of the prostate. And if there is any irregularity or a nodule or a mass, it can be very easily felt. The next logical step is a multiparametric MRI, which is very specific for prostate. With this, you can actually see the entire architecture of the prostate gland. And if there is any abnormality, that can be delineated, and we can actually identify the area from which we can do a biopsy. So if there is something abnormal on MRI, a biopsy is done either through the rectum or through the perineum. It's an OPD procedure, quite painless, not too many side effects if you have taken proper precautions. And we sample the entire gland by taking about 12 to 14 biopsies and send it to the pathologist. The pathological examination is the final test by which you will know whether there is cancer or there is no cancer. Okay. So once the cancer is proved, then we want to find out how much is its extent in the body. So we do a PET scan, which is very specific for prostate. It's called prostate specific membrane antigen PET scan, PSMA PET scan. And this is being specific for prostate. It will tell you all the areas of spread, whether in the bones or the lymph nodes, or if there is no spread, then you're reassured that the patient has something which is early stage disease. So then how do you treat this cancer? If the cancer is in the early stages, we can treat it with surgery, what is called robotic radical prostatectomy. Nowadays, open surgery is hardly ever done. It's always a robotic method, which is, the recovery from this is extremely fast. It's a very precise surgery. You can go right to the prostate and do it under good vision, good magnification, and the results are excellent. The patient goes home in 3 or 4 days, and this has become the standard of care now. Suppose the patient has a lot of medical problems, then is there something that we can offer him? Instead of surgery, we can give them external beam radiation therapy, and which can also give results that are equivalent to surgery in these patients. And the cure rates with both these procedures are more than 90%. Now, in advanced stages, however, there is no role of surgery. You may use radiation sparingly, but the mainstay of treatment is hormonal therapy, chemotherapy, immunotherapy, etc. But the outcomes are not as good as with early stage disease. So, how do I diagnose prostate cancer early? Know your risk, whether you have a family history, whether you are nearing 80, and there should be annual PSA testing. Normally, we start from the age of 55 years of age, but in high risk men, those with family history, usually the cancers come early in this age group, so we start from 45 years of age. And what is very important is you report to the doctor immediately if you have any urinary symptoms. There is a tendency, if you go to your general practitioner, often they'll give you tablets which will relieve your urinary symptoms, but the cancer may be growing inside. So go to a specialist if you have any urinary symptoms like that. And of course, lifestyle changes like avoidance of obesity, regular exercises, managing your diet properly, all these things will allow you to prevent cancer as well as diagnose that early so that you can live long. Coming to gynecological cancers, by gynecological cancers, I mean the uterine cancer, then the lower part of uterus called the uterine cervix, also, and then the ovarian cancer, which is on either side you can see the ovaries and the fallopian tubes. So ovarian cancer is the commonest in this age group of senior citizens. This is most lethal and aggressive gynecological cancer with the highest death rate. And that's basically because all over the world, at least 70% of women are diagnosed in this stage, where the treatment is extremely difficult and cure rates are poor. And the main reason for late diagnosis is lack of symptoms till advanced stages. What are the risk factors? Again, older age, although there is a group of ovarian cancer called germ cell tumors that is seen in the younger age, in the teens and 20s. In women who have their onset of menstruation early or have a late menopause, what's called a long estrogen window, they are also at a higher risk of developing ovarian cancer. Again, women who have no children or who have their first pregnancy late, that's after 35 or so, they also have a higher chance of developing ovarian cancer. Those who take estrogen based hormone replacement therapy after menopause, especially without medical supervision, can get ovarian cancer. Now, this is very important. Nowadays, we are living in an age of IVF. Now, there are certain drugs which are used for ovarian stimulation, and if these drugs are given repeatedly for many cycles, then there is certainly a higher risk of developing ovarian cancer. Family history, extremely important. About 15% of ovarian cancers have a genetic predisposition. So if there is a family history of breast, ovarian, uterine, or large intestinal cancer in the family, in the blood relatives, the mother, sisters, cousins, grandmother, nieces, then you are also at a higher risk of developing ovarian cancer. Similarly, a lady who has breast cancer or who's had breast cancer and has been treated for it, or uterine cancer or large intestinal cancer, there is a higher risk that during her lifetime she will develop ovarian cancer as well. However, even if you have none of these risk factors, you can still get ovarian cancer. Now, symptoms of ovarian cancer. Ovarian cancer is known as a whispering cancer or a silent killer because the symptoms are extremely vague, non-specific, and subtle in the early stages. The lady usually complains. The most important complaint is abdominal or pelvic pain, heaviness, bloating. You know, the kind of lady will say, after I eat a little, also I feel full. There is bloating. There's a lot of gas. Now, this is common amongst everybody. Okay, bloating, indigestion, nausea. All of us get, women and men. But important thing to remember that if a lady says, I'm not able to finish my meal, and after I feel hungry, but when I start eating, then after a little while, I can't go further. I have to stop. There could be change of bowel habits like constipation or diarrhea. Could be urinary frequency, urgency, incontinence, sometimes menstrual irregularities in premenopausal women, unexplained loss or gain of weight, fatigue, breathlessness, all this. Now must remember that all these, as I said, are minor variations of our daily routine. But if these symptoms persist for more than 2 weeks, or the symptoms are new, or the symptoms are recurrent, happening again and again and again, then you must go to the doctor immediately. Do not assign a cause to the symptoms. I had some chana, that's why I'm getting gas. No, that cannot happen for 2 and 3 and 4 weeks. So you must seek prompt medical attention. Get a sonography done urgently, because this could be the only window during which you have a chance of diagnosing ovarian cancer early and hope for a long-term cure. So do not ignore if symptoms are new, persistent, or repetitive, and especially more than 10 days in a month. So when you have these symptoms, you go to a gynecologist. They will do a complete clinical examination, including an internal examination, breast examination, and there are three, basically, the diagnosis depends on blood tests called the tumor markers and imaging like ultrasound or CT scan or a PET scan. Now, there are certain tumor markers like CA125, which can give you an idea about presence of cancer. And in the younger age group cancers, the germ cell tumors, the other tumor markers are useful, which are called alpha fetoprotein, beta HCG, and LDH. Imaging is done either with sonography and then confirmed by a CT, MRI, or PET scan. And how do you treat ovarian cancer? Early stage disease, extremely easy to treat, surgery followed by chemotherapy. In young patients, you can preserve fertility by preserving ovary and uterus, and the results are excellent. In advanced stage disease, however, this is one of the most difficult surgeries for any cancer, is surgery for ovarian cancer. So this is called a ultra radical cytoreductive surgery followed by chemotherapy, or sometimes chemotherapy followed by this kind of surgery. Here, of course, despite doing all this, the results are poor. In the early stages, 85% of patients are cured. In the advanced stages, only about 30 to 35% of patients are cured. In the younger age group germ cell tumors, however, these are excellent prognosis. They're extremely chemosensitive, and the cure rates are more than 95%. So what do we advise regarding ovarian cancer? Find out whether you are at an increased risk. If yes, consult your gynecologist for risk-reducing surgery. That means you have a history of breast cancer and you have the BRCA mutation, which is positive. Then there is a 50% chance that you may develop ovarian cancer. So if that happens, then you should get your ovaries and the fallopian tubes removed after you have completed your family, and this will prevent ovarian cancer in future. A healthy lifestyle and all this is for any cancer. What is important is have your first child early and have 2 or 3 children by age of 30. When you have more children, the risk of ovarian cancer becomes progressively less. Breastfeed for 6 to 12 months. Beware of early symptoms and do not ignore them. Go to a gynecologist or oncologist. And remember, there is no screening test like PSA for prostate cancer. There is no screening test for ovarian cancer. So if you just have to have a high index of suspicion, when you have symptoms, go to the gynecologist. Coming to next common cancer, uterine or endometrial cancer. That means there is the cavity of the uterus. If the cancer develops there, then that's called endometrial cancer. Excuse me. Again, this is seen in the older age group. Not having children is an important risk factor. Polycystic ovarian disease in the younger, when the girls, if they have polycystic ovarian disease, then when they become older, they're at a higher risk of developing endometrial cancer. This is again something which is very specific to uterine cancer, is diabetes mellitus, metabolic syndromes, and obesity. These three are very, very commonly associated with uterine cancer, and one must see that one doesn't have obesity, one has regular physical activity, controlled diabetes and metabolic syndromes. They are very important to avoid endometrial cancer. Again, tamoxifen, that's a medicine which is given for breast cancer, can also induce endometrial cancer. So you have to keep the uterus under surveillance when you're taking tamoxifen. Um, Again, if there's a family history of breast, uterine, ovarian cancer, or the genetic predisposition, they're at a higher risk of developing uh, endometrial cancer. Symptoms of endometrial cancer and cervical cancer are almost the same. There are abnormal vaginal bleeding in the majority, which could be episodic or persistent. But sometimes it's just spotting, which is very, very commonly ignored by women. They say, we don't know from where the blood was, whether it was from the rectum, from piles, or whether it was from the vagina, or whether it was from through my urine. Remember, even one single episode of bleeding or spotting after menopause must be investigated. You must go to a doctor. Do not assign a cause yourself to your symptoms. You must get this investigated. I've had hundreds of patients who have ignored this and they have come to me at an advanced stage when they had symptoms for 4, 5, and 10 years also. Said, I had one episode of spotting 10 years ago, then 3, 4 years there was nothing, then there's another episode, and now, of course, it has become much more. So if you ignore those symptoms when they are small, you're going to land up in big trouble. Again, abnormal vaginal discharge, pain during intercourse, etc., and back pain, which is persistent, abdominal pain, distension. These are all can be symptoms of endometrial cancer. Do not ignore them. With these symptoms, usually the most important investigation is an ultrasound, including a transvaginal ultrasound. And what is usually seen is you can either see a mass or a polyp, or it could be just a thickened endometrium. A thickened endometrium in a postmenopausal lady is an indication of endometrial cancer. And then we do a hysteroscopy, by which we actually go inside the uterine cavity with an endoscope, see the lining of the uterus, and then curate it out or scrape it out for diagnosis. And of course, we follow that up with a CT scan or PET scan. And early stage disease, again, surgery is the best option. And you can either do it by the open method or laparoscopic method or a robotic method. All three methods are fine. This is the only gynae cancer where robotic or laparoscopic surgery is indicated. For ovarian cancer, no robotic surgery or laparoscopic surgery. For cervix cancer, no laparoscopic surgery or robotic surgery. It's only for endometrial cancer. Now, if a lady who is young, and I'm seeing more and more young women or young girls coming with uterine cancer, they're in their 20s and 30s, and about 10% of uterine cancer patients are young, they're desirous of childbearing. So, can they have a chance of becoming pregnant? Yes. If the disease is early, we can treat these women with high dose progesterone, there's hormonal therapy, and they can have successful pregnancies without compromising cancer care. For endometrial advanced cancer, you can have multiple modalities of treatment, and with immunotherapy coming into being, the survivors even in advanced cancers have now improved. Lastly, coming to cervix cancer, we know that cervix cancer or cancer of the mouth of the uterus, the part of the uterus that can be examined by a gynecologist by clinical examination. And this cancer used to be very common in the past. Now it's come down. That's basically because we know the cause of this cancer, and this cancer is largely preventable. It's caused by a virus called the human papilloma virus, which is sexually transmitted. And there are different subtypes, but some of them are high risk for cancer. This infection is seen in most women in their reproductive age group, but it's usually cleared by our body resistance. Only when it becomes persistent that it can cause changes in the cervix, first leading to precancer and then cancer. This takes a long time, And we have a lot of time during which we can diagnose this uterine precancer, cervical precancers. So what causes persistence of this virus in the body? Again, the risk factors, like most important is tobacco use in any form. Then you can have immunocompromised states like somebody who had a transplant, somebody who is HIV positive. All these patients are at a higher risk. Those who have poor genital hygiene. In our country, this is extremely common, extremely important, especially in rural areas. Again, there could be women who have multiple sexual partners and they have a higher risk of developing cervical cancer. Again, there are reproductive factors like those who get married early, those who have an early onset of sexual activity, early first pregnancy, and multiple pregnancies within short intervals between pregnancies. Again, this subgroup of women is again more prone to develop cervical cancer. Important to remember, this is not hereditary, this is not contagious. Another important thing to remember here is uh, just because a woman has a HPV infection doesn't mean that she's going to develop cancer. One, and one should not, that having an HPV infection should not be a taboo because all women in their, at least 80% of them during their reproductive age group are going to have this infection sometime or the other. So we can prevent this cancer, I said. What are the ways to prevent? Most important is that we have HPV vaccines. They are prophylactic vaccines against this infection. And since they're prophylactic or preventive, they should be given before the onset of sexual activity. And that's why it's recommended for girls between 9 and 14 years of age. And it can be extended as a catch-up vaccination up to the age of 26. There are 2 or 3 doses depending on the risk and the age, and can be given up to 45 years age after counseling. But the thing is, the effect of these vaccines is going to be very, very suboptimal. It is an extremely safe vaccine. The hundreds and thousands of women all over the world who have received this vaccine, they're very, very effective. 95% protection from cervical cancer and cancer, at least after 10 years, and the safety has been established. Now, if we can't prevent cervix cancer, want to diagnose it early, how do you diagnose? What about symptoms? Remember, very important, in precancerous and early cancer stages, there are no symptoms of cervical cancer. The earliest symptoms are intermenstrual bleeding, that means bleeding between two menstrual periods, postcoital bleeding, postmenopausal bleeding, and blood-stained vaginal discharge. If any of these is present, it could be an early indicator of cervix cancer. But one should not wait for symptoms to appear, and we should go for a checkup. Now, I understand that this is not for your age group, but you have daughters at home, daughters-in-law at home, and you also have your grandchildren, granddaughters at home. For them, it is important that your grandchildren should, granddaughter should have this HPV vaccination to prevent cervical cancer in future. And for your daughters, what should you do? You should recommend a pap smear. That means a cytological examination of the cells which are collected from the surface of the cervix and seen under the microscope. And a good pathologist can tell you that these cells are normal, or cells of precancer, or cells of cancer. Now, we should start at the age of 21 when the lady is sexually active, and it should be done once in 3 years. Now, going one step further, we have what is called HPV DNA testing, which is more precise, and it can be done from starting from the age of 30 and can be done once in 5 years. Actually, both these tests can be done with a single swab, and it can be done once in 5 years. So if you do both these together once in 5 years, you have a very, very good chance that you will diagnose this cancer early. These are very easy, quick, painless OPD procedures, widely available, and also not expensive. Sometimes just a simple clinical examination can show you that there's something abnormal in the cervix, and with application of certain chemicals, you can highlight those changes and take a biopsy. So how do you treat cervix cancer? If there is there's only a pre-cancer, then one doesn't need to remove the uterus. Very important for young women. So they're treated with either laser excision or cryotherapy, cauterization, and hysterectomy is usually not required unless the lady wants it. But once the actual cancer happens, then early stages are treated with surgery, what is called radical hysterectomy, by the open method, not by the minimal invasive method, the surgery or radiation therapy. And both these give excellent results, again, more than 90% survival. But once the disease becomes advanced, then it's a combination of radiation therapy and chemotherapy. There is no surgery here involved. The treatment is more expensive, more complex, and the results are then poor. So what should be our strategy? Vaccinate the child and screen the mother. That means the child should have vaccination, and the child's mother, who is in the reproductive age group, should have pap smear and HPV DNA. For you, do these tests, pap smear and HPV DNA, and that is the best way for you to protect yourself. Remember, cervix cancer has a second peak now after the age of 60. It has been demonstrated in all the countries. So there is an increased risk in people over 60 again. It's not only in the reproductive age group. So remember, it can happen to you also. So for you, you must go and get yourself screened with pap smear and HPV DNA and catch cancer before it catches you. Thank you very much.
Thank you very much, Doctor, for a very detailed and excellent presentation. I'm going to, we've received quite a few questions, but I'm going to just ask some of the ones which are. Doctor, can you close your presentation?
Yeah, I'm doing that.
So even as you're doing this, there's a question that has been asked about how effective, this is from Shamila Ravi, how effective is gene mapping to detect prostate and gynec cancers in early stages?
Gene mapping is done mainly for gynecological breast and ovarian or uterine cancer and large intestinal cancer. And in patients who have a family history or those who have a prior history, like a lady who has been previously treated with breast cancer or ovarian cancer, in them, one should do a genetic testing. Definitely, we should do genetic testing, especially if those cancers in relatives or yourself were diagnosed at an early age. A lady whose cancer is diagnosed at the age of 30 has more chance of having a genetic basis to it than a lady whose cancer is diagnosed at the age of 60. So,
Right.
if prior history of breast or ovarian or uterine or large intestinal cancer or these cancers being present in any of the blood relatives puts you at a higher risk of developing these cancers. In these patients, one must do proper genetic testing. There are gene panels which are available for each of these tests, and that should be done. Why should not be done for everybody? Because they're expensive. And everybody will have some small gene defect here or there. And then there is a lot of fear in the minds of women where the risk actually is not much. So we should do it only in high-risk patients, high-risk women rather. And you can detect these cancers early because you're going to do an active surveillance for these cancers then.
Doctor, how much do these gene testing, how much does it normally cost?
It depends on the panel, but there is something like at least about 50,000 or so, 25 to 50,000, depending on the lab. Now, there are certain local labs which are do it at a lesser cost, but normally if you go to very standard labs, it's about 40-50,000 at least.
All right. Thank you. There's a question from Sunita Verma who asks, can intake of sugar products add to developing cancer?
It is not right at all. I mean, there is a lot of this thing about sugars and cancer and something about dairy products and cancer. There is absolutely no relation whatsoever between sugar and cancer. They say cancer cells need sugar, but so do the normal cells. Okay, so there is no higher risk if you're having sugar or having dairy products.
Right. There's a question from Anita Rakshat who asks, should all senior women take hormone balance treatment?
Hormonal therapy should not be done unless the doctor specifically recommends it. there are some women who have severe menopausal symptoms, or only in those patients one can give hormonal therapy, because any external hormone for a long period of time can be dangerous, can be harmful. So do it under medical supervision and only if it is needed. One of the main problems after menopause is loss of calcium from the bones. So if you're taking calcium supplementation, that problem is taken care of. So there's not too much that one needs to do. Very, very few people actually need a hormone replacement therapy.
Right. There's one more question from Sunita Verma who asks, these days PCOD is very common in younger generation. Does
Yes.
this develop in cancer later on?
Yes, PCOS can be a high risk factor, because again, PCOS happens because of hormonal imbalance. See, normally there are two hormones which are secreted by the ovaries called the estrogen and the progesterone, and they are in perfect sync with each other. And whenever there is a tendency towards, what's called hyperestrogenism, that means the estrogen becomes more preponderant than the progesterone, then you can have PCOS, you can have ovarian cancer, you can have breast cancer. So PCOS, prior history of PCOS has been shown to be a high risk factor for ovarian cancer.
Right. One last question, doctor, and you could answer this because you're yourself a senior citizen. What is the perfect diet for a 60 plus to avoid cancers?
Don't ask me. I don't think I have a perfect diet at all. But basically, a very balanced diet. We should have a lot of fruits and vegetables, especially green vegetables. Avoid any kind of processed food or oily or fatty food. Avoid red meat, definitely. So these are the things which are important in your diet and which are very, very easy to incorporate. That doesn't mean that you can't go out and have a pizza or have a burger once in a while. That's fine. But there is a tendency, especially in our youth, in the younger age group today, that every meal is outside, every meal is processed food. Now, these women are definitely, when they become older, they'll be at a higher risk of developing these cancers. So, for us, what is important is proper diet, green vegetables, fruits, avoid red meat, most and important physical activity. There is no replacement for physical activity. Physical activity has been known to protect against various cancers in our body.
Right. Doctor, one last word I would request from you, since we are getting into this Cancer Awareness Month, and over the next month or so, there's going to be a lot of activity in terms of awareness, etc.
Right.
Since you've been with the biggest hospital in the country, Tata Memorial, for
Yes.
2 decades, and you've been
Right.
in private hospitals also now. Your word on cancer care available in the country, because there are still a lot of people who are going to a Tata Memorial, and there's so much of rush over there.
Yeah.
Uh, what is the kind of level of cancer treatment available across the country today?
I think the things have definitely changed over a period of time. When I was in Tata, I started in 1980s. That time there was hardly any cancer care that was available in the country apart from Tata Memorial. So it was a foregone conclusion that everybody would want to come to such a place. But now, across the country, we have different kinds of hospitals. We have Tata hospitals at various places. We have All India Institute at various places, and where we have trained people, trained surgical oncologists, trained radiation oncologists, medical oncologists. So such care is available. Of course, because of the faith and because of faith that I'm going to get the best treatment, people still come to Tata Hospital. But I'm sure that over a period of time, this trend is going to reduce. It will not be eliminated completely. People will start taking treatment in their respective, the cities nearby or in their own towns. A lot of people, new oncologists are getting trained, and they're going and they're settling down in their own places. So I'm sure the trend is towards treatment of cancer at their local places, and that's the welcome thing. I think that should be our future. The government has taken a lot of initiative to do that, and I think it's a very, very welcome initiative.
Great. Thank you, Doctor. Thank you, Dr. Hemant Tongaonkar, for being here. And thank you to all you medical practitioners, especially in the field of cancer across the country that we have. You are doing great service um, uh, to everybody here, especially senior citizens who require all the help. Thank you once again to the Nanavati Max Hospital to facilitate this, and to all of you there. Please do take care of yourself. As
Yeah.
Dr. Tongaonkar said, it's good to look out for the symptoms, and even if there are no symptoms, even if there are some minor issues that you face, go to the doctor.
Yeah.
Don't hesitate in doing that. I did that for my voice, which was absolutely down last week, and it's back. So good to take good medical care when it's available. Thank you, doctor, and we will be back once again next
Just
Saturday.
one word that
Yeah,
next month is the February is the month of World Cancer Day.
right.
So this particular month, I would urge all the senior citizens to devote one day for their own health, go and get themselves checked up completely. And I'm sure that in the whole year, you can definitely devote one day, or you could choose your birthday. That day, devote to yourself, get all the investigations done. Thank you.
Thank you. With that word, thank you very much. And we will be back once again next Saturday at 5 p.m. with another session of Health Live at Seniors Today. Do remember that there's a fair amount which is happening at on Evergreen Club and on Seniors Today, the website, the magazine, etc. So do keep watching. Thank you very much.
Subscribe now and press the bell icon. Never miss an update.